I'm going to be doing a video today on the Millennial Development Goals 3, 4, and 5, and I'm going to be discussing solutions to the problems. And so my country is Guyana, and it is located in Southern America on the coast next to Venezuela and above Brazil. Millennial Development Goal number 3 is promoting gender equality and empowering women. So for girls in some regions, education is very hard to get and sometimes unavailable. Poverty is a major barrier. Men outnumber women in paid employment. Women are largely put into more lower forms of employment, and they're not put into government or positions of power. The top level jobs are still going to men, and women are slowly rising in political power, but mostly it's just men. Goal number 4 is reducing child mortality. So child deaths are falling, but it's not quickly enough. They're trying to put in efforts against pneumonia, lowering nutrition, controlling the measles, and if they could control it, it would save millions of lives. Improving maternal health. Most maternal deaths could be avoided, but giving birth is really risky for those, especially in Southern Asia and Sub-Saharan Africa, where most women, they deliver without skilled care. So it's important for my country that these be fixed, because my country has met the target of eliminating gender disparity in primary and secondary education, but they're still working on it in all levels of education, and they haven't gotten there yet. They need to further promote the equality of women in all aspects of life. Government's priorities include ensuring the implementation of proactive legislation and various initiatives, including training programs. For the child mortality rate, the country has met the target of reducing the under 5 mortality rate by 2/3, but they still are working to improve child mortality. And they're focusing on the quality of care of under 1 children, especially around the time of birth, and improving the nutritional intake for both women and children, because what the mother eats, the child gets. So they're working on that as well. And then goal number 5 is they're working on maternal health, and progress has been made, and Guyana has succeeded in reducing the number of maternal deaths and increasing the availability of skilled professionals. But they're still they still have problems with maternal health, and they really want to improve the quality of care offered by the professionals, even if they do have skilled professionals. They want universal access to reproductive health available. So the 5 sections that I'm going to be talking about are Section 1, country background information related to goals 3, 4, and 5. Section 2, a key problem related to goals 3, 4, and 5. Section 3, a solution that helps eradicate the key problems. Section 4, regional impact, and Section 5, global impact. So, Section 1, country background. So, the climate in Guyana is tropical, it's humid. They have 2 rainy seasons, May to mid-August and November to mid-January. The terrain is mostly rolling highlands and low coastal plains, and a savanna in the south. Their natural resources are bauxite, gold, diamonds, hardwood, timber, shrimp, and fish. And the natural hazards are flash floods in their 2 rainy seasons, and they're very vulnerable to climate change. And they have extreme weather patterns and events, the rainfall leading to floods. They also have water pollution from sewage, which is a huge problem with the flooding because all of that dirty water goes to the population. And they have agricultural and industrial chemicals. Agriculture and the industrial occupations are really, really high in Guyana. And deforestation is also a huge problem. And deforestation is, and all these extreme problems that they have with their weather, it is affecting maternal health and child mortality rate because they're getting these diseases and these illnesses from the contaminated water. And the infant mortality rate is 36 deaths per 1,000 live births for males and 29 deaths per 1,000 live births for female. They have a problem with HIV and AIDS. There's about 11,000 people living with it. They had about 1,200 deaths from it. Literacy rate is higher for men. It's 99.1% for male, and female it's 98.5%, and so they're not getting the equality with that. Men are being educated better than women, and women aren't getting the education that they should. So long term, if the problems aren't fixed, then they're going to keep increasing. The mortality rate is going to get higher. Women aren't going to get the opportunities that they should. They're not going to get the education they need. And women actually live longer than men in Guyana. And I think that if they had the opportunities that men did, it could really benefit since they're living longer. They could take care of their children better. They could get jobs to help their families. And that would also improve the child mortality rate because women could be able to take care of their children better. The death age is going to lower. People are going to die sooner at a lower age, which is hard to believe since they're already dying at 65, which is kind of young if you compare it to other countries. Illnesses are going to spread. Pollution and sewage are going to spread, and they're going to increase, and the water is only going to get more contaminated, and there's going to be more diseases spread. And so our next section is going to be section 2, the key problems related to goals 3, 4, and 5. So deforestation it's actually increased instead of decreased. Guyana has made no commitment to reducing or even stabilizing the emissions of forest carbon. And timber has actually increased a lot in 2010. And so it appears to have increased, the rate of deforestation has increased by 3-fold. And it's not decreased like it should be. And so with this increase, you're affecting children's health rate. They're not getting their global warming, and the CO2 emissions are affecting children. Like, their immune systems at such a young age can't handle it, and the reason why children are dying so young is because of deforestation. Women are being underpaid, even though it's been said that they would actually help women. They had entered into an agreement to provide higher wages, but instead their women are being underpaid. And they're trying to say that they want to put women into higher positions in government and have them in political parties, but if they're not even keeping their word with paying them in their jobs, then I don't think they're going to do that either. And then for women's maternal health, there's been high rates of domestic violence, but they've been also dying while giving birth. And women, it just shows you that how little they value women's lives. And over 500,000 women die every year from complications of pregnancy and childbirth, and they're totally preventable if they would just be willing to fix it and willing to get more skilled professionals. It kind of goes along with gender equality, because if men were in the same situation, the problems wouldn't exist. One woman believed this, and she said that it's hard to fight with this logic because they're finding a cure for balding hair, and it seems to take medical preference over putting an end to maternal mortality.